Hello everyone, welcome back po sa ating channel again. This is Joel Pasqua, and for today's video, we are going to discuss a concept under your urinary elimination problem. But before we proceed to the actual discussion, guys, don't forget to subscribe, hit the like button, and of course comment naman po sa ating video, and also share it with your nursing friends. For today's urinary elimination problem, we are going to focus our discussion in the benign prostatic hyperplasia. So, or your BPH, your benign prostatic hyperplasia is a condition wherein there is a slow enlargement of the prostate gland in men more than 40 years old. And as you can see, this condition is just common for men simply because women doesn't have prostate. And this is a condition that commonly arises when a man already reaches the age of 40 and above. So kasakit po ito ng medyo may mga edad ng lalaki. So your slow enlargement of the prostate would actually affects now the function of the prostate, which we already know that prostate is actually the one or the organ involved in the production of your semen, which is the considered as the transport mechanism of the sperm cell that would actually you can see this during ejaculation after a sexual performance or a sexual engagement. Now, for your benign prostatic hyperplasia, from the word itself, hyperplasia, it is an enlargement wherein it causes now constriction to the urethra, which is the passageway of urine from the kidney or from the bladder to the during elimination or during urination. So, because of the enlargement, it will now constrict the surrounding tissue, including now the urethra, causing now subsequent interference in urination. Okay? Or it will try to impede or block due to compression yung daanan ng ihi natin sa mga lalaki, which is your urethra. Now, your benign prostatic cancer, benign prostatic hyperplasia, okay, general etiologic cause is unknown, or in other words, it's idiopathic, meaning that the cause is actually unknown, and we don't have the exact etiologic factor that can actually contribute or relate into the development of these conditions. But there are several predisposing factors that may increase the chance of a man developing this condition. So what are these predisposing factors? Number one is aging process. As you can see kanina sa ating first slide, this is a condition common to men that reaches age of more than 40 years old. So it comes with age sa mga lalaki. Okay? Aside from that, it may also be related to hormonal imbalance, such as the presence of estrogen sa mga lalaki, okay, and also your androgen, which is the male hormones. So these are the following etiologic factors that may develop po kapag ikaw ay, or I mean that may contribute to the development of your BPH or benign prostatic hyperplasia. Now, what are the assessment findings? So how will I know, sir, if I have this condition, or how will I know that my father or my grandfather or my lolo, tatay, has this condition? So you want to find out, or you want to check on this following assessment findings. Number one, urinary frequency. So urinary frequency, basically napapadalas ang paghihi, pero kadalasan pa konti-konti lang. Okay? Kadalasan nga, lalo sa may mga edad na, like for example, my senior citizen tatay or lolo natin, okay, nagkakaroon sila ng tinatawag na dribbling. Okay, so dribbling is basically yung ihi nila, imbes na projectile or malakas yung pressure, madalas po is parang tumutulo lang. Okay, so parang tumutulo lang from the urethral orifice, tapos na idadrop lang papunta sa kanilang paa, sapatos, tsinelas. Kaya napapansin natin sa may mga edad, parang mapanghipo sila because nagdadrop nga sa kanilang mga underwears, pantalon, or sa kanilang paa. Okay, because of the dribbling. Pero continuous bilang, madalas po silang parang naiihi kasi hindi nila naiihi lahat. Aside from that, UTI, urinary tract infection, which is correct because as we all know, the urine has something to do with the balancing of the bacterial or microorganism that is actually in housing in our urethral tract. So basically, kapag hindi maganda ang ating pag-ihi, dumadami din sila ng dumidami doon, and possible na dahil hindi natin naiihi lahat, okay, naiipon din yung mga waste products in the urethral lining causing now your urinary tract infection. Aside from that, nocturia. So nocturia is frequent urination at night. Okay, common po yan sa mga pasyente na merong BPH. What else? Okay, hesitancy. So hesitancy, tulad ng sabi ko kanina, though meron silang urge to urinate, however, kapag sila umiihi, hindi masyadong madami. Pakunti-kunti. So madalas lagi silang nakakaramdam na naiihi. Okay? Then residual urine. Yung, sabi nga sa Ilocano, yung tartaraudi, yung parang umihi ka naman as biglang mamaya pagkatapos mong umihi, when you try to put back your underwears na biglang may lumalabas ulit. Okay, that is your residual urine. Kaya nagiging mapanghinga po ang underwears ng mga taong ito. So from that, decrease in force of urine stream. Like for example, kung ikaw ay binata, 'di ba, at the age of 19, the androgen level is the testosterone level is high. So kapag umiihi ka, yung parang hose pa na talagang it literally nag-stream doon sa bowl. So sobrang lakas ng pressure. But for patient or for person or for men with BPH or benign prostatic hyperplasia, nagkakaroon ng decreased force in the urination. Okay? Kaya nga sabi ko kanina, possible na nagkakaroon lang sila ng dribbling or yung pakunti-kunting ihi pero madalas na pag-ihi. That is your decrease in force of urine. Okay? So what are the diagnostic tests that can be performed in order to assess for the presence of your BPH? Number one, cystoscopy. Of course, silipin natin. Baka merong malaki or paano natin masilip doon? Transurethral. So may papasok na camera sa may ureter ng lalaki, then sisilipin natin um, papunta doon sa ating upper urinary tract, okay, urinary tract, and to see if there is a decrease in the or narrowing of the passageway in the urethra, causing now by the compression that is due to the enlargement of the prostate gland. Okay, cystoscopy. Those cystoscopy, so copy visualization. Another one, renal biopsy. Okay, so renal biopsy. So once we confirm that there is a buccal, pwede tayong magkaroon ng renal biopsy to check if the condition is indeed benign or malignant. Another one is your prostatic massage. So basically, you're going to palpate in the pubis area. Okay, pubic area, kung meron ba tayong enlargement of the prostate. And pwede din naman tinatawag yung digital rectal. Ayan, pwede tayong magpasok ng yung daliri sa rectum ng lalaki and to check kung mayroon bang bukol. Okay, basically nakakapa natin yung ating prostate when we do that. Okay, the relief of suction by insertion of indwelling catheter. Okay, so for example, you have urinary retention, then you insert now your catheter to remove the stagnant urine in the bladder, and you're going to immediately feel a relief afterwards. Then basically possible na meron kang benign prostatic hyperplasia. Okay, so how are we going to manage now the condition? Okay, so though the condition is hindi naman siya yung automatic makamamatay, but of course it will bring a lot of discomfort to the person, especially to elderly, okay, kapag meron sila nung condition na ito. So what are the management that we can do? First is we can go with the pharmacologic management. Number one is giving your terazocin or your hytrin. Terazocin or hytrin is an A1 adrenergic receptor blockers. That relaxes now the bladder and sphincter. So basically, it will try to relax the bladder and sphincter. Hopefully, this drug will able to now facilitate urination properly for this patient. Okay? Another drug that we can use is your finasteride or your Proscar. Finasteride or Proscar is inhibits 5-alpha reductase or blocks uptake and utilization of androgens by the prostate. So basically, pipigilan niya yung paglaki ng ating prostate, okay? Or decrease granular hyperplasia, okay? Or pipigilan niya yung paglaki ng ating prostate. Now, if in case that the pharmacologic management was not successful, that's the time we will go with the next with the next management, which is your surgical removal of the prostate. So the surgical removal of prostate, from the word itself, we are going to do a surgery to remove now, or at least decrease the size of your prostate gland. So how are we going to do that? Okay. First surgery that we can do is your TURP. Actually, this is the most common surgery na ginagawa to reduce the size of the prostate. Your TURP, or your transurethral resection of the prostate. Your transurethral resection of the prostate is done, okay? No incision. Yes, you heard it right. There is no incision included in the surgical procedure. Why? Because the surgery will be done transurethrally. Ibig sabihin, may ipapasok po tayong camera, okay, sa penis ng lalaki, okay, to access now the urethra, okay, and access the area where the compression takes place due to prostate hyperplasia. So, no incision kasi may papasok tayong camera sa urethral orifice. So, prostate resected through the urethra, and a continuous bladder irrigation or your cystoclysis will be done. So, yung cystoclysis, ginagawa ito. Actually, nagulat ako nung first time ko nag-handle ng ganito sa case sa hospital. Ang ginamit nilang tubig is actually, ang ginamit nilang irrigation solution is hindi NSS. Actually, it's distilled water. Okay, distilled water. And yung common brand lang na distilled water na meron tayo in the market. Okay? Which is common na ginagamit nila when doing the surgery. Okay? So cystoclysis is the continuous bladder irrigation. Okay? No incontinence will occur with this one. Ibig sabihin is tuloy-tuloy ang urination niya afterwards or after the surgery. And no impotence. Yan. Good news sa mga lalaki, hindi po kayo mababaog. Okay? Or hindi po kayo yung hindi na tatayo si Manoy. Okay? You would still, your penis would still feel erection afterwards. So this is the most common questions na tinatanong ng mga tao na undergo ng surgery na to, na kung tatayuan pa ba sila, mababawasan ba ang libido, okay, mabawasan ba yung pagkahilig? The answer is no. But of course, initially, pwedeng mabawasan because of the pain. But afterwards, kapag nag-heal na po yung sugat, okay, internally, because of the resection na ginawa sa prostate, then eventually, the urge, okay, would still be there, and of course, no impotence will occur. Okay? Another surgical procedure is by the way, this is a picture, by the way, of how does the procedure takes place. We have the here in the screen now. This is the normal prostate here. So, you kita nyo, yung bladder natin is medyo maluwag. That's the urethra. I mean, this is the bladder, and this is the urethra. Okay? And this is the prostate. So this is a normal prostate, and once the prostate becomes enlarged, this is what will happen, and it will now cause constriction on this area, causing now your urinary retention or urinary incontinence. Okay? So basically, ang gagawin nila is magpapasok sila ng camera through the urethral orifice. Okay? Urethral orifice. Going now to this area, and an instrument to dissect or resect the prostate will be used, okay, or the resectoscope, okay, to scrape now this area to relieve now the urethra from compressions. So basically, may bleeding yan, of course, and some bleedings will go out because of the cystoclysis or your continuous irrigation. Some would remain in the bladder. Kaya nga, after the procedure, the patient may need to still have cystoclysis or your continuous bladder irrigation. Okay? And this is what will happen. So, if this is the enlarged prostate gland, the resectoscope will be inserted here. Okay? Then, scrape po nila yung enlargement na yon one at a time. Okay? Paunti-unti po yan. And during the surgery, actually, nakikita mo siya sa TV. So, it's a monitor doon sa operating room. Then after that, once they scrape it out, this is gonna be, it looks like. Okay, the last picture. So that is the TURP or transurethral resection of the prostate. Later on, I will be discussing the post-operative interventions or management that you need to do after I discuss the other two surgical procedure that can be performed, kasi halos pare-parehas naman po sila. Okay? Another one is surgical removal of the prostate. Another one is your suprapubic naman po. So from the word itself, suprapubic prostatectomy, okay, an incision over the lower abdomen will be performed, okay, just above the bladder. Okay, so with cystostomy, tube, and two-way Foley catheter. So basically, sa symphysis pubis natin, merong itutusok, okay? May itutusok na ganun din. It's a tube, then a camera will be placed, okay? And will actually access the prostate of the patient. So, para po siyang laparoscopic procedure pa rin. Okay? So when you say laparoscopic procedure, a monitor or a camera is always involved. Okay? No incontinence will occur and no impotencies occur. It's very important to explain this to the patient because this is one of the major concern of the person who will be undergoing the procedure. Okay, mawawalan po ba? Hindi na po ba ako tatayuan? So, alam nyo naman, pag voice concern po talaga po yan. Okay? Another one, aside from the suprapubic, we also have your retropubic prostatectomy. O, prostatectomy. So your retropubic prostatectomy naman po is an incision will also be made but it's above the abdomen na po. It's above the abdomen. Kung kanina is sa suprapubic lang, just above the pubis area, okay, or the symphysis pubis, we're going to insert now a trocar, okay, a tube that will now visualize where the camera will be inserted. Ito naman, literal, magkakaroon tayo ng malaking incision in the abdomen, okay, to access the symphysis pubis. So, ito yung tinatawag na open. Okay, open surgery to. Though yung suprapubic po is open surgery, pero mas small yung incision kasi nga may insert po tayong CT tubes. I mean tube. Okay? No incontinence and no impotence will occur also under this procedure. So to have an idea, this is what it gonna be look like. Okay? So yung mas malaki po yung incision niya, yung kanina po doon sa suprapubic, mas konti yung incision. Pero kung gusto nyo ng walang incision, it's gonna be your prostate your TERP or transurethral kasi nga ipapasok 'yan sa ating ureter. Okay, sa ureter ng lalaki. So that's it. Now, what are the post-op nursing care? Dito papasok ang ating mga management bilang isang mga nurses or bilang mga nurses. What are the things that we need to do? Of course, increase fluid intake. Take note that bleeding may occur inside and we want to flush now the fragments that is a product of the procedure na nandun sa ating bladder. So if you want to do that, we need to increase fluid intake para mas ma-facilitate natin ang urination ng pasyente or umihi ang pasyente. Another one is maintain patency of the catheter. That's very important kung nakakatheter ang pasyente. Okay? Bakit kailangan natin check ang patency? Take note that there are fragments that is a possible product of the procedure. So these fragments would also cause now the blockage in the catheter. That's why it's very important to maintain patency of this. Okay? Sabi nga ng wife ko, kapag nag-undergo sa nito, kailangan ng continuous flushing. Okay? Continuous flushing. Kasi pag hindi ka magpa-flush, magka-clog talaga and the patency of the catheter will also be affected. Another one, if drainage is reddish, increase the flow rate because a reddish drainage would mean that there is an active bleeding. And this is a common finding especially during the first hour after the surgery. So expected po na reddish ang kanyang drainage. Expected po yan. Pero hindi na yan expected for after 24 hours, reddish pa din. You have to refer that to the doctor already or to the physician. But once you have observed this reddish drainage, either if it's initially or several hours after, the next thing that you need to do is to increase the flow rate. Basic po yan because we need to change the blood volume that the patient is losing because of the active bleeding na meron. So increasing the flow rate because that would replace now the blood volume na nawawala. And take note, aside from increasing the flow rate, you also need to monitor the vital signs, especially the blood pressure and the cardiac rate to check for possible signs of your hypovolemic shock. Okay? So, i-check mo po yan lagi. Practice asepsis. Okay? Lagi naman po yan. Post-surgery, we have to practice asepsis that the patient's wound, if there is, okay, incision needs to be cleaned at all times and has to be free from any type of infection. Okay? Use sterile sodium, your normal saline solution to prevent water intoxication, especially during during flushing. Okay? Pag flushing. So during flushing ng surgery, pwedeng distilled water lang. Pero kapag yung flushing na during post-op, you have to use of your PNSS or plain normal saline solution. Other nursing care includes prevention of thrombophlebitis. So how to prevent thrombophlebitis? Yan. So you have to make sure that there is a patent access. Okay, and of course, raise yung kanyang foot, okay, to promote venous return. Okay? Monitor for hemorrhage. Again, a reddish blood drainage or a reddish drainage would mean that there is an active bleeding. This is normal initially, okay, during the first hour of post-surgery. However, after that, it's no longer normal. So if there is any presence of bleeding, you have to refer this immediately to the physician, especially if it's more than 24 hours already. May feel bladder fullness. Bakit? Kasi nga, is dilated pa rin yung bladder natin, and because of the continuous irrigation, you would also, the patient would actually feel na punong-puno yung bladder niya. And because of this, the continuous bladder irrigation is done to facilitate removal of whatever fragments is left due to surgery. So pwede kasi may mga naiwan na blood clots, mga scrape parts of the prostate that are inside the 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 bladder. Actually, in some cases or in most cases, we are going to strain the urine. Okay? Strain the urine. So you have to strain the urine after ng TERP or transurethral. Okay, to check for the fragments. Okay? Another one is after removal of catheter, observe for urinary retention and dribbling would indicate that there is still compression. Kailangan wala na po sana yan. Kegels exercise is also done as part of the therapy of the patient. This is to increase the force of urination later on when the patient is already recovered from the surgery. And of course, avoid any anticholinergic agents and antihistamine because this may cause now urinary retention and we don't want that to happen already. So, kailangan umihi na po sila. Okay? Continuous irrigation po kasi yan. So, those are the post-op nursing care. To include also, upon discharge, we also need to advise the patient to avoid the following. Bawal po ang vigorous exercise. So, wag muna pong mag-exercise. Okay, wag po muna mag-weight sa gym. So, mga passive exercise or active exercise at the bed is advisable, pero mga vigorous exercise like lifting heavy objects is not advisable at all. Okay, heavy lifting because it will now increase the pressure. Pwede magsiputukan po kung meron pang nag-heal na sugat, pwede ulit mag-bleed. Sexual intercourse should be avoided 3 weeks after discharge. Why? Because it needs time for the prostate to heal. And take note that our prostate gland function is to produce semen. And semen is very important during sexual intercourse kasi nga, ito yung magbibigay ng satisfaction sa lalaki kasi nga because of the ejaculation. And pag mag-ejaculate ka, you are forcing now the prostate to work and hindi pa nga po siya ready. So you have to avoid sexual intercourse at least for 3 weeks. 3 weeks after that, then so be it. Okay? Mag-enjoy ka hanggang gusto mo. And next, driving 2 weeks after discharge is also avoided because it would actually compress yung area where the incision or where the surgery had occurred. So you have to prevent driving 2 weeks or to prevent or avoid driving 2 weeks after discharge. Straining with defecation is or should be avoided. So you have to eat foods high in fiber, increase consumption of fluids to at least soften the stool, and if in case na may constipation, the doctor might advise you to have lactulose to soften the stool. So the thing here is that you have to avoid straining as much as possible. Okay? Prolonged sitting and standing should also be avoided. Okay? Because this would cause now pressure on the area. And of course, crossing the legs would also increase pressure. Plus, long trips should be avoided. So, isabay nyo muna sa bakasyon nyo. 3 weeks after, wala mo ng long trips kung paano nyo pumunta ng ibang lugar or bansa para mag-honeymoon or so on and so forth. So please avoid those things because it can actually worsen the condition post-operatively. So those are the things that you need to remember as a nurse when you try to handle this type of patient. Remember that once you are handling a patient with this type of conditions, you still need to follow the nursing process. Whenever there is an abnormal findings, yet the thing is abnormal, always starts with assessment first. Assess where the problem is, then afterwards, the part of the nursing process follows. Okay, lagi po tayo mag-umpisa sa assessment. May nakita kang signs of bleeding, then assess ano kayong possible conditions or ano yung possible situation ng pasyente. May nakita kang possible signs ng infiltrations or anything that you think is abnormal before you start reporting to the physician. As a nurse, you have to perform first your function as a nurse, which is your independent nursing function, and that includes now your assessment. Okay, assessment, then try to find out what would be the problem, and if it's a problem that needs urgent referral, then you need to refer the situation to the attending physician. Okay, so if you do have any questions, guys, don't forget to please comment it down sa ating comment section. We will try to answer those questions sa mga next videos natin. Sa mga nagre-request po ng mga videos po, I'll try to do it within this month. O sa mga free days ko po, medyo busy lang tayo ngayon. And I hope that you're enjoying my videos. And if you do, don't forget to subscribe, hit the like button, and of course, comment and share this video sa ating mga nursing friends. That would be all. Thank you and salamat po. Bye for now.